Hello, hello, everybody. Thank you so much for joining us for another Beach Connection session. I know we still have a few folks trickling in. We're really happy to have you here, our parents, our family members, students of incoming CSULB students. This is our Beach Connection session with our health and wellness team. So you'll hear a little bit about health and wellness on campus. How are we ensuring your students' health physically, mentally, overall well-being? And some, immunization requirements and things that are pertinent to that you all for you all to know as parents, things like that. We're really happy to have you join us all for this afternoon's presentation. If you don't know already, I'm Nina Luxon. I'm the program coordinator for new student and family programs, and I mainly work with parents and families throughout the academic year. So you'll see a lot of things from us and a lot of communication from me. If you've already attended parent and family orientation, you likely have already met me. So welcome back. Again, thank you so much for making the time to be here online with us today. We'll start with a presentation from our health and wellness representative, Damien, with us today, and then we will be answering questions. We'll be answering them live. So if you have a question, please feel free to submit it at the bottom in the Q&A box. That is going to be the best way to get those questions answered through the Q&A box, and we're happy to answer those live during the presentation. If folks could, please remain muted throughout the presentation. That way we can just ensure the program runs smoothly and throughout the duration of the webinar, we can just focus on the questions that are being submitted in the chat. That would be the best course. But for now, I'll go ahead and hand it off to our health and wellness team with Damien, and he'll begin his presentation. I'll be here.
Thanks, Nina. Good afternoon, everyone, wherever you are, wherever you may be. I'm Damien Zavala. I'm the Associate Vice President of Health and Wellness here at the beach. So welcome to the beach and welcome to the college life for your student or your son or daughter, whoever's going to be coming here. First of all, I want to congratulate you and your student for coming to the beach. We get over 100,000 applications every year. So the fact that your student was accepted to our campus is quite an accomplishment. So they should be very proud, as you should be very proud. So here at the beach, we have made a commitment to beach wellness, and beach wellness includes several aspects. It includes the mental health, physical health, there's financial health, there's several things that we focus here on as well. And part of that philosophy is that of course, students are going to get an education here. They're going to get their diplomas and graduate and go on to bigger and better things. But we also want them to educate themselves, or we want to educate them as well in the area of wellness. And so as they mature and they go on their journey, we want them to learn, well, when should I go to a doctor? Should I reach out to a counselor? Should I get my flu shot this year? So we want them to walk away with several wellness tools in their box to help them be successful beyond their college years here. So I have a presentation to share with you, and please feel free to ask questions, as many questions as you need. There's no such thing as dumb questions, and so please ask away. So I'm going to start with an area that's not as health related, but I mean, it is connected, but not quite as directly related. And that is our emergency contact information. So we encourage all of our students to have an emergency contact on file, just in case there's an emergency and we have to reach out to a parent, a guardian, a sibling, somebody if there's an emergency. We typically run about 40% of our students having one on file, which for me is low. I'd like to be in the 80s or 90s if folks can put that on there. So please encourage your student to have an emergency contact on file. And then also there will be this portal, I'm not sure if it's still functional, but there will be a newsletter so you can subscribe to that. There's a lot of things happening here on campus, and I work here and I can't keep up with all the cool things that are happening on campus. So please sign up for the newsletter so you can talk with your student about things happening on campus, or maybe you'll want to come to campus and participate in some of our things. We have great sports teams, we have great theater, we have all kinds of stuff. So please get involved as well. Okay, so every one of our school websites and public websites has our health and wellness resources available on it. So any of our Cal State Long Beach websites, you can scroll down to the bottom And then in the left column, you will see health and wellness resources. So if you missed something today, go to any of our websites and you'll find it there, as well as students know that that's where they can go if they need to find information. Here's a couple of our virtual resources that we offer to students. The first one is our Beach Crisis Text Line. Now, this is an outside vendor that we've contracted with for 24/7 coverage. It is anonymous. It's a hotline for mental health support. It's offered in English and in Spanish. And students can also offer the number to their family members if need be. And this is a text conversation that takes place with real people. It's not a bot or a chat. And it can escalate to a phone call and other services if need be. But typically there are conversations that happen on the text line, and then we get that information, and then we can reach out to the student to follow up and make sure that they're getting the support that they need. The second virtual resource that we have is called Find Help Now, which is a real-time decision tree that students can access for resources. This covers 5 counties. It covers Orange County, LA County, Riverside County, San Bernardino, and Ventura counties. So this will give them resources on campus and in their home community if needed. We have students that use this for other family members if needed, and it's broken down by category of resource that you're interested in, and it has several questions. Are you a student? Or are you staff? What is your situation? What are you most interested in? Is this an emergency, non-emergency? And then it gives you a list of resources. You can copy the link and send it to somebody. You can print them out on your computer. You can always go back and find more. And we're not tracking who's using it, how often they're using it. It's all anonymous. So we want people to use that resource when needed. Okay, so as I mentioned earlier, part of our approach here is a more holistic approach to our student body and to our staff and faculty. We want them to consider several aspects of their wellness. And so this is just a diagram we like to share that we're looking at the holistic approach to what we're doing here on campus. Okay, here are 3 of our campus resources that tend to be more of our popular resources that are used. Our CARES program is a group of case managers on campus who receive referrals from faculty, from staff. Sometimes we get them from parents, sometimes we get them from other community partners. And there's a way for people to put referrals in for a student. And it's a voluntary program. The student does not have to accept the help, but we hope that they do. And what happens is we'll get a referral. We'll read the referral, maybe reach out to the referrer, have some follow-up questions, and then we reach out to the student to try and engage them, to help them with finding resources, linking to those resources, setting up appointments, and helping them navigate through whatever difficulty they're having. We typically get a lot of referrals for CARES around breakups, first relationships, losses in their family. It could be a homeless situation. It could be financial situations. It could be problems with roommates, problems with classmates. There's just a variety of reasons. We typically see in the fall, we see a lot of breakup. We see a lot of relationship things. And then in the spring, we typically see a lot of anxiety around classes, around being behind in their work. And so the anxiety is increasing at that time. And like I said, the student it's all voluntary. They're not required to take our help, and we encourage them to. And then if we have multiple referrals on a student, then okay, there's several people that are seeing the student on campus that are concerned, and then so we try to reach out to them multiple times and hopefully engage them for some of the support that they need. Our CAPS department is our counseling and psychological services. And this is a group of counselors that we have, master's and PhD, all licensed folks who are mental health providers that provide short-term therapy, group therapy, drop-in spaces, and places for students to just talk. And this is one of our more popular areas to visit. And we're not providing long-term therapy. We're trying to help students get through the semester, help them on a short-term basis. One of the myths that you'll hear or your student may hear is that there's a limit to sessions. That's not accurate. We don't have a limit, but we don't have the ability to serve a student long-term. So the work depends on the counselor and the student. For example, the conversation could be around after they do an assessment, okay, we're going to meet for 5 or 6 sessions, and then we're going to end at that time. And then a student is able to come back the next semester if they want. They can come back the next year. They're not ever given an infinite time that they have to use their services. They can come back for a tune-up. Maybe they have another crisis and they want to see the same provider, maybe a different provider, and the student can do that. And then our CAST program, as you can see, we don't have enough C names. We have to add more C names to our campus. Is we have a mobile mental health team. So we were the first in the Cal State system to develop our own mobile mental health team. And these professionals are embedded in our police department. So we've had situations where our police are responding to mental health crisis with students or faculty or staff, and we know when they come on site with a firearm and full uniform, it has a very different tone. So we wanted to have a more trauma-informed, humanistic approach. So we hired 2 licensed professional mental health professionals that are embedded in our police department. Sometimes they respond with the police officers. Sometimes they'll respond without the police officers, and just a more humanistic approach and touch to these situations. Been very successful. Sometimes we have people that aren't even connected to the campus that'll come on. We have homeless folks that might wander on the campus. We have the VA facility over here on the corner. So sometimes we get vets that wander over. And so that team will also support anyone on the campus that may need some support, whether they're a student or not. And so we're very proud of that program. And that runs Monday through Friday from 7 to 7. So here are some more services of our counseling, our CAPS program. I mentioned earlier, there's brief counseling, there's group counseling, crisis counseling, help with referrals, a trans care outreach programs. A student can also walk into the CAPS office without an appointment and they'll be seen. So they're encouraged to call and make an appointment, but no one will be turned away without an appointment. Here are some of the drop-in community spaces, and these are spaces where a student doesn't have to have an appointment. They can just pop in and join the conversation, and the topics change from week to week. It's not necessarily therapy. It's a safe place for people to come and share their thoughts and feelings about a particular topic. It's kept confidential, and so our students like to gravitate towards these drop-in spaces. And maybe a student is not ready to see a counselor one-on-one, so this is a good first step and a good place to start to see if they might be headed towards that or might be interested in that. So our CAPS program is located in Brotman Hall, which is our main administrative building. And there are the hours Monday through Friday, 8 to 5. After 5 o'clock, if a student calls, we have an after-hour service that is staffed by a mental health professional. So oftentimes in the morning, we'll have a report of a student that called in at night, and here's the situation, and we'll follow up with the student the next day. So if a student calls, there's still resources for them. There's our phone number and our email and where we can be found. And this is our Student Health Services team, and we have our own clinic here on campus, a freestanding clinic, and I'll talk more about that. We have a good-sized team here on campus. Here are our immunization requirements for students for next year. We want all students to get those first 3 immunizations, international students, athletic students, and housing students. Now, if you don't have all of your immunizations done by the deadline, your student will not be disenrolled. They will not be, it's not a punitive thing. We just encourage students to get them done as soon as possible, especially this year with measles starting to flare up a little bit. We want our housing students to make sure that they have all of their immunizations and requirements. There was a measles case here in Long Beach, a pediatric case, that came from international travel of a young child. And I believe currently there were 14 cases in the state of California. So we keep an eye on that, not only on campus, but up and down the state. And we work very closely with the Department of Public Health here in Long Beach, and we collaborate with them very closely. And so we're always keeping things on the radar, trying to be diligent for our students and for our faculty and staff. So here's our student health services information. We have
Hey,
medical service. I'm
sorry
sorry.
to jump in. We had a question
Sure.
in the chat for vaccines. Is that for all students? Could you please clarify which vaccines are mandated for all students versus like housing and things, and go back to that screen?
Yes. So the first three are for all students. The hepatitis B, meningitis, and the measles, MMR. So those are for all students. So I can stay on this a little bit longer if you want to take a picture. We'll also have this recorded so you can come back to it later as well. And if your student is curious, they can also apply for a medical or religious exemption if they're not willing to take the immunizations.
And somebody asked in the chat, those are required, correct? All three of those
Yes, those
vaccinations.
are required.
And then for international students, athletic students, and housing students, the ones that have the check mark are also required for those populations, correct?
Yes. Yes, required or an exemption if they apply for an exemption.
Okay, thank you.
And we have these here at Student Health Services, so if the student wants to come here and get them, they can do that as well. So let me go back to this slide for a minute. So if your student is on your health insurance or has their own health insurance, we encourage them to keep that. Our student health services are included in their student health fee that they pay to come to school here. And it's $88 a semester, but they can come as many visits as they need. We have a pharmacy, we have over-the-counter medications at a fraction of the cost as they would get them in the community, buying them at CVS or Walgreens or another place. And I encourage students to come in and buy for their families as well if they need it. And anybody can do that as long as you have a campus ID. You can come and get over-the-counter medications. But the reason we encourage students to keep their insurance, we're limited in what we can do here, even though we can do a lot of things here. If a student needs to see a specialist or they need a procedure or something done that we don't do here on campus, then their insurance would cover that. We also work with the student if they have insurance to help them find a provider in their network if needed. For example, if the student needs to find a particular specialist that is in the area, we have a referral nurse who will help them navigate that system to find what they need. So we have X-ray in the building, we have a lab, we have a pharmacy, we have several doctors, several nurses, several medical assistants. So we see a lot of various things that come through our doors. So here's student records. So if your student is over 18, they will need to give you permission to see their records if that's something that they want to or willing to do. Students have access to their records using a portal, and they can access that as needed. And then we also want to collect information regarding allergies, medications, any prescription details, overall health history. And then we are bound by HIPAA, so we protect our students' confidentiality and their privacy. And students have to be 18 and over, must sign a release of information to release records to anybody other than themselves. And then if your student is under 18, we'll need a consent for treatment form to be signed by parent or caregiver in order for us to provide service. So here's some of our fees. There is a out-of-pocket expense for some medications or some and over-the-counter items. Some of the immunizations have a fee as well as some of our lab tests. Our student health fee is not health insurance, but they can get a lot of things here on campus. and we're very close. If they're here on campus not feeling well, they can pop right in. And again, like the CAPS department, they don't have to have an appointment. They can walk in and they'll be seen. So we encourage you to keep the health insurance if you're already in the plan. And if student needs help getting insurance or understanding insurance, we can also help with that. And here's our contact information and our website. Immunization questions, here's an email you can send them to, and our nurses field those questions and respond. And a lot of our services are very low cost, so we encourage our students to use them as needed. Okay. And that's the end of my presentation. Do we have any questions in the chat, Nina?
Yes, we do. So for the first question is, to use CARES, do you have to qualify?
No, no, there's no qualifying for CARES. It's a free service for students, and as long as they're willing and interested in services, they're free.
Awesome, thank you. Somebody asked, for the vaccinations and the immunizations required, for housing, would they know if a roommate is exempt?
They would not know if a roommate is exempt because that's confidential information. Yeah.
Awesome. Somebody said, I'm having difficulty accessing the patient portal to submit vaccinations for housing. They submitted the document and are now getting an error message when attempting to log on, but that they didn't get prompted to pay a $150 fee. So how should they navigate that?
They should navigate that by sending their question or their experience to the email, our vaccination email. And so let me go back to that. I could read it off for folks. So for the person that asked that question, I would send an email to SHS slash, oh, we can put it in the chat as well,
That's what I'm doing.
slash vaccine at csulb.edu. And we have that's a common thing that happens when folks are registering. Sometimes it won't let them fill out things or take care of things. So our staff can walk you through that.
Thank you. And I put that email in the chat for you all. So if you'd like to contact somebody for immunizations and those kinds of questions, that email is in the chat for you. Another question is the ROI online?
No, we have a ROI hard copy form in clinic. So when students come in and they want to release information, we have them sign the hard copy form, and then we scan it into our records.
Awesome, thank you. Another question, it says, is the form to allow care for minors on the website somewhere?
You know, I should know this, but I don't. I would have to check to see if it's on there. It should be, and if it's not, I will double check.
Okay, I'll ask the next question. I'll look for it on the website,
Okay.
see if I can find anything. This person asked, is CAPS free as well? And what are Thoughtful Thursdays?
Yes, CAP services are free to students, and Thoughtful Thursdays are it's really a mindfulness practice, and so Thoughtful Thursdays they'll have a different topic on a Thursday. It might be some school related topic, or it might be a family related topic. It could be non-related to school or family, and just a time for them to be thoughtful and practice some mindfulness and have a place to focus on something else other than school or work or their families.
Perfect. For the question regarding the caring for minors on the website, I am putting the website in the chat right now that you can visit. It also gives information of how to contact the office that question could be best answered for, including things about the patient portal and where to find those PDFs and things. So it has the PDF right on the website as well. Okay.
Looks like there's a question about getting health insurance and where to get it. Um, there's not a hard deadline for getting health insurance. I would try to get it as soon as possible, but as soon as school starts or as soon as a student is registered for the fall, they can access our services here at Student Health Services. And we're open year round. So in between semesters during the summer, our clinic is open. So your student can come and use this year round. I'm not sure where to get it, depending on what kind of health insurance you're looking into. Even if your student comes here and is interested in applying for health insurance, we can help, our nurse can help them with that.
Awesome. Thank you. Another question says, can prescriptions or lab work from an outside physician be done on campus?
We don't accept prescriptions from off-campus physicians. All of our prescriptions are written here by our doctors. If it's say a student they've been taking a particular medication for a while and they meet with one of our doctor can write that prescription to keep that going, but we don't take brand new or refills from docs outside of our clinic. But they can bring their lab work to our clinic and we can scan it into the record if that's something the student wants to do.
Thank you. Another question about the CARES services. Could you talk a little bit about how CARES works and how CARES functions for students?
Sure. So CARES functions as a support service. So the CARES team will get a referral with the information, who the student is, maybe what their concerns are. And then we reach out to the student in several ways. We reach out to the student via phone, via a email, letter, and then also text. And depending on the situation, if it's, for example, once in a while, we'll have a student that discloses they have suicidal ideation. So that we would escalate to our mental health team. We may want to reach out to the student in their classroom, do a welfare check in real time. So that's a very serious situation. We have other situations where maybe a student is struggling with a particular challenge. And so we'll do all those things to reach out to a student. We reach out initially when we get the referral. We give them a couple days to respond. If they haven't responded, we reach out again. So we do 2 to 3 weeks of outreach to the student. And typically during that time, we've made contact with them. Either they could schedule a meeting with our case managers. When they schedule a meeting with our case managers, the case manager will do a full assessment of the student, not only for the need that they're referred to, but there typically are other needs that the student hasn't shared with anybody. So they may come in for one thing, but it usually turns into multiple things. And so based on that assessment, our team will help them locate those resources on campus or in their community, and then help them get linked to those. And by linked, I mean either they help them get an appointment, sometimes they walk them over to the department, they help them do that if needed. So our team will do as much as we can to support the student to get those services on campus and in the community.
And as far as a student getting referred, what is the process for that? That's done by faculty, staff, students, or how does that work?
That is done by faculty, students, staff. Yeah, almost anybody on campus can refer a student to the CARES department. We try to keep as much information confidential as possible. We're not sharing that news across campus. And so, but we do try to reach out to the students to get help if they need it. Yeah.
Thank you. Another question. It says, for after hours emergency care, where do the students go?
For after hours emergency care, they can call Student Health Services. We have an after hours line for nurse support, or they can call our counseling, our CAPS department, counseling and psychological services, and we have an after hour service there as well.
Awesome, thank you. Another question, can prescription medications be mailed to the dorms? This is for a chronic condition, or what is that?
Yes, they can be. Yes, they can be mailed to the dorms. The dorms will store them for the student, let them know that they've arrived, and then get them to the student. Yes, that can be done. That can be done. Oh, it looks like somebody found the authorization forms and the ROI, so very good. Thank you for that, Stephanie.
Awesome. Any other questions, folks, please send them in the chat or the Q&A. We are happy to answer them. Currently, we have no pending questions.
Okay, all right. Well, thank you for your attention, everyone. Look forward to supporting your students. And if you have any questions, please reach out. You know your students very well, so if you see something or are concerned about something, let's say, my son's a chronic condition. Do we have 31 or something? Yes, you for the person with the son with the chronic condition, we would want to refer them to our Bob Murphy Access Center, and so they do accommodations, and so that's the department that would be able to help him with that. Yeah, so that's not one of my departments, but if your student needs an accommodation, maybe they have an IEP, maybe they have a condition that they need certain accommodations for, the Bob Murphy Access Center, BMAC is how we call it on campus, is a place for your student to go. They'll have to fill out some forms, but they can help with the accommodations for their academic accommodations.
Thank you.
Okay.
Seeing as there's no more questions in the chat, I will take this back. I just put in the chat a few different links, folks. The first one is for our parent and family orientation. If you have not already attended our parent and family orientation, it is very important, and it has a lot of really great information for you to take in. So if you could register for that, that would be really great. You can be with us over the summer. We also we've recorded this presentation. It will be posted on our YouTube page tomorrow. So go to Parent and Family Programs YouTube. You'll be able to access that and access this information again. And just reiterating the Beach Family newsletter. That is the primary way that we communicate with all of you regarding things on campus for your students and updates and things like that. So please register for that. It is completely free. It's an email that comes every 2 weeks, and it just gives you the latest campus updates and things. And that's kind of what Damien was talking about a little bit earlier.
Yeah, there's another question about a prescription given from us able to fill in their insurance pharmacy. We have the ability to send prescriptions to other pharmacies off campus for students, so yes, we can do that.
Perfect. Any further questions, please feel free to reach out to the Student Health Services Department or to Health and Wellness via the emails that Damien put in the presentation. But otherwise,
please don't be strangers. Encourage your students to get help when they need help. Their 4 or 5 years is going to go very quickly, and encourage them to get involved, get connected to things on campus, and enjoy their time here at the beach, as you as well. All right.
Awesome. Thank you so much, everybody. Have a good night.
Bye-bye.
Bye.